We're here in Nashville at Healthcare Design 11. This year we have grown to 4,000. It's continued to rise and grow. I think that speaks very much to the establishment of the healthcare design community, which is what we strive to do here at the in-person event, the premier in-person event of the industry.
The Healthcare Design Conference has really broadened over the years. As the industry has grown, we've really expanded the content of the conference. So really what the Healthcare Design Conference does is it mirrors what's happening in the industry. So we listen to what's happening in the architecture design industry, and then we go from there and we create the tracks that are going to help articulate that best.
One of the roles of the Academy in this conference is to be part of the panel that guides the content of each conference.
This is a venue that we can really reach the design community in a really significant way. It's one of the major conferences that most interior designers who are doing healthcare attend. So for us to be able to reach that audience and to be able to provide content in terms of educational programming, and then also to provide a connection of our community together is really very, very strong. See that as a great value to the healthcare interior design community.
A conference like HCD allows the design community to track the latest and the newest and the most innovative forces and ideas and trends in the marketplace that we can all learn from. I think now, perhaps more than at any other time in history, the magnitude of change is such that the design community is having to pay extra attention to what those forces are and what the innovative kinds of solutions need to be.
The healthcare industry is a rapidly changing industry. As designers, it's so important for us to be really understanding these issues very thoroughly and to really begin to think innovatively about how we solve these problems. By coming to healthcare design, it allows us the opportunity to learn about what is coming down the road, to interact with other individuals from all different areas of the world and all different professions. Healthcare interior designers cannot work independently or solo without really understanding what other disciplines are doing and all the issues that impact the built environment.
What's happening is that technology is having a huge impact in healthcare. And the facility manager, not only in the building systems, but in the medical equipment itself. The facility manager of today should have much higher level skills and knowledge to be able to run the job.
We know that the economic constraints and the requirements for performance and quality are going to drive the healthcare delivery community to a new model. We're not clear what that model is. But we can come to a conference like HCD and hear what thinkers, what visionaries are imagining that new delivery model might be.
And that's why we really try to have our keynote speakers at the conference not be from our industry, because we're really trying to see what can we learn from other people? What are other people doing that can help inspire us? And so what you have available to you at Healthcare Design is you can be in a large general session listening to industry experts. You could be in a small breakout room having a conversation with other people around specific topics. There's the opportunity for you to enter into the conversation and be a part of the learning, because we have as much to learn from one another as we do from the speakers.
One of the things I like the best about coming to the Healthcare Design Conference is the opportunity to interact with all the other people that are here. To be able to share ideas, to hear what other people are doing. I think that's one of the really great things about being a part of this.
The Healthcare Design Conference is all about face-to-face networking, and nowhere in the conference does that bear itself out more so than the exhibit floor. Where the attendees and the people who make the products and services that make their jobs easier can really get together face-to-face.
This year we've had our highest exhibitor turnout yet, with over 350 exhibitors on the show floor. There's nothing like the tactile feel of actually experiencing a product and the ability to shake hands with their clients and meet new people from varying disciplines within the industry, to show their products, to physically show their products.
Attendees are very happy that we have such a large exhibit floor. The opportunity to see all of that in one place at one specific time of the year is invaluable to our attendees.
Are you all ready to get started? Well, make your way out to the dance floor. We're going to teach you a line dance called hot foot.
You know, being a part of a community is a really big deal, and a lot of times the work that we're doing is difficult because you're fighting against so many issues, whether they be economic issues or clients who just need to get it done quicker, faster, cheaper. And so having other like-minded people that you can get together with once a year and share war stories and really support one another, I think emboldens people to be able to say, all right, I can do this again. I can go out there and I can fight this fight because it's what I believe deep inside.
We don't work in a vacuum. None of us do. So by being able to collaborate with each other, be able to share ideas, talk about the challenges, really kind of face the issues in a venue such as this is really quite an asset. And the more that we can do that, I think the more that we recognize that that we're not addressing these issues alone. You know, there are many of them. It takes all of us really to solve the problems that are out there.